Okay.
Hi, Dr. Rob. I put a
Hey,
question in
Tammy.
the answered. It is, as we speak, my husband is attending week 4 of Out of the Doghouse. Should I expect to see any changes in his behaviors towards me? For example, being more relational, being present, showing compassion and sympathy or empathy, I'm sorry, and listen to me when I express that I'm experiencing triggers. What practical things is he learning that can help recover our marriage? He is also working with a therapist. And this person does not indicate a CSAT therapist or if there's sex addiction, it's just the betrayal. So I'm just
Okay.
clarifying for you.
So 2 things. You're a little herky-jerky, Tammy, just to tell you that. You're kind of, so just so you know, your words and face don't quite add up, but that's just to let you know. I wondered if you'd like to start answering this question, to be honest, because I don't know, it just seems like a Tammy question, and I'll answer after you.
Well, I haven't looked through the curriculum, quite frankly. I have so much on my plate. I have not read through the curriculum for
But
Out
you
of the
know the book.
Doghouse. I have read the book. I haven't read it in a few years, to be honest. So, I mean, I
Oh,
can quote page 75 of Prodependence, but but that's a whole
okay.
different thing. So
Well,
I think for anyone to expect magical changes in 4 weeks of 90 minutes a week it's psychoeducation. So there are tools that are learned, but they have to be practiced. They have to, there's homework assigned, there's opportunities for changes, but change is a process and takes a lot of practice. Somebody who's doing something this direction and needs to swerve to this direction, there's degrees that need to be gone through. So should have some insights about how to do things better and differently. Realistically, having big sweeping changes, I would not expect. But I would, I think it's fair for you to say, not what are you learning and what did you write down or whatever, but I think it's fair for you to have, what are you taking away from this group? I've had some really good comments sent to the facilitator about how enlightening it is, and the guys are hearing it. It's just moving it from here down to here and implementing the actions, that's challenging. But I would love to have you have a conversation about, in a but just in a curious way. I'd love to hear, how you're feeling about this group. There's an Out of the Doghouse, 2, so more will be revealed. But have realistic expectations. Even if guys come to treatment, I say we don't magically fix up them, in the time that they're with us. They're going to have a whole bunch of skills and tools that they didn't have, but they still have to, if you're, yeah. So it was, if you pray for potatoes, you better pick up the spade. You got to be willing to use the tools. So that's my
well,
thoughts.
Tammy, for someone who didn't much to say, you did really well. I'm gonna say that. Um, you know, um, how do I answer your question? Look, I want to say, first of all, I think your questions are good ones to be asking, because what you're looking for, compassion, empathy, being more relational and present, is exactly what you want and makes sense for a healthy relationship. So of course, those would be the things you're looking for. I probably would say something like, I had hoped that things were more. I don't really feel the engagement I was hoping from with you, and I'm wondering if there's anything you're learning from that might help us be closer. Like Tammy said, I wouldn't probably, get really deep into the, what have you learned this week? You don't want to turn yourself into mom. But the other thing is that, I say a lot, and Tammy, I have to say it in the right way. We can learn fairly quickly how to stop the addiction, but being kinder, nicer, more emotionally generous people can take a long time. And I am glad that your spouse is learning the pieces that he needs to learn, but how to make use of them takes time. I would also think these are therapy issues, which is, gee, I don't seem to be as empathic as I'm supposed to be, or as I want to be, or, what am I missing? Stuff like that. I also be curious, how does he feel about taking the course? Is he resentful? Do you do it to, a lot of, and I'll just say this, if you're an addict, the course you should, and you're just starting in the process, the course you should take is Sex Addiction 101 or Porn Addiction 101, learning the basics from your perspective. I see a lot of men and women who are addicts go right for out of the doghouse. That's the course they want. That's the book they want to read, because that's about learning how to seek forgiveness and be more empathic with your spouse. But to do that first is to do it backwards, because being more empathic and loving to you and then continue to act out is not really helpful and not exactly empathic. So while these lessons are important to learn, and I think need to be integrated into the work, if you're not sober and you're not being honest and showing integrity, it doesn't matter what book or course you're taking. So the first question I would want to ask is, and you didn't say this, is he sober? Is he going to
He
support
may not be
groups?
an
Is he,
addict. I mean, that like the out of the
I
doghouse
don't know.
is one course that isn't
Well, that's true.
necessarily about addiction, as is the attachment wounds. I mean, you can identify as a cheater but not really have the so it's more complicated than that. But yes, if some, I mean, we do know that there are some people that ideally would be over in the Sex Addiction 101 group, so
Well, I would also say if you're in the middle of having an affair and you haven't ended it, regardless of whether you're an addict or not, and you're right, Tammy, I really appreciate your mentioning more about the book that I wrote. So you're more in touch with it. But it is for men who've cheated on a woman. It isn't simply on, and it's not a recitation in how to recover from addiction, because as Tammy said, it's not a book about addiction. It's about healing a broken relationship where you cheated and you don't know how to make it better. And as I've said a bunch of times, I have never met a man yet who truly understands how to heal a relationship where a woman has been wounded by betrayal. We are so lined up with flowers and candy and moonbeams and taking you on vacation that we don't understand the emotional piece is so much greater than that. And that's, I think, what the book is about, is saying, hey, this is a much bigger deal than you realized. You've destroyed the trust in this relationship, and it isn't going to come back with a few flowers and moonbeams, nor is it going to come back in 3 months. I can't tell you how many men we work with in recovery who get 90 days or 6 months of healing, and everybody in their group says, yay, you've got sobriety. And then they go home and say, look, honey, I've got sobriety. It's been 3 months. And their spouses look at them like, well, we've been married 20 years. So 3 months, not so impressive to me. So this is all also part of the challenge for addicts, is we're used to seeking validation and support from you. And now we can't get it, nor should we get it. So anyway, lots of answers to that question.
well, and one more quick thing, the information that he's learning, there's homework. That's the great stuff to take to his therapist and work on, like there will be insights, there'll be patterns, like those type of things. So, that would be great work for him. I hear often actually from therapists that appreciate having their clients in the work groups because they see so much more progress. This is psychoeducation. It's not the stuff that you're going to get in a 50-minute session with your therapist. So the two of them together, can really help a lot. So okay, next question. My husband of 18 years is an SAPA. We are 7 months into our second D-Day. He is sober but not in recovery yet. He sees a CSAT weekly but has been dragging on everything else. He said today that he has had thoughts that a separation might be good for him to work on himself and have to do this on his own. Should I see this as a red flag of possible relapse, or should it be something that we look into? Have you ever known this to be helpful for the relationship?
Well, I'm going to read into this one, if that's okay.
Please.
Most of the men that I work with who are involved in relationships with women deeply want those relationships to work. And one of the reasons they come to seeking integrity, I think 90% of the men who come in who are straight come in because they want to rescue their marriages, and they are or their family lives, and they're so invested. Honestly, can I stay? Will she let me stay? Will he let me live there? Can I, even just live in the closet, because I so want to be around them and be have them be a part of my healing. So I have to say that this is a red flag for me. And it makes me think, is this someone who's having an affair and they want to have more time in their affair? Is this someone who, you said he's sober and not in recovery? I don't know that there's a whole lot of difference. Maybe
Oh, I
just the
do. I
acting out
discern.
is the sober.
Yeah, I discern
Sober is
abstinence to
useful.
sober and recovery. Yeah.
Sober is great, but being a person who's committed to healing and being a better person is just as important. How about that? And so I have to wonder, is this person having an affair? Are they still involved in their addiction? I wouldn't see it as much of a relapse as a big warning sign for me. Do I need to get a lawyer to make sure I know what my rights are? Do I need to look at the money? I mean, what is going on with this man? Because it is not typical. In fact, what is typical is for a female spouse to say, I want you out of here for a while. Or maybe a therapist might say, I think a separation might be good for you guys. But for the addict to go to the spouse and say, I think I'd like a separation, to me is a warning sign. It just is. What does he see himself getting out of this? And how does he possibly see it's going to help you guys to heal? Just doesn't sound like something an addict would say. But Tammy?
So yeah, a whole bunch of red flags that I have to do this on my own. He he'll no, I mean, recovery is about healthy connection. It's about those work groups we were talking about. It's about everything else. He's dragging his feet. So to me, and I'm making this up because it's just what I'm reading, but I was like, oh, you're feeling like he's dragging his feet. So you're paying attention to what he's not doing. And he probably feels some pressure about that. And so if he goes somewhere else, then you're not there and he doesn't have to think about, to me, it's compartmentalizing and preparing to act out, whether he does or not, I don't know. But, I'm with Dr. Rob. I would, I would, and if you're going to do even a therapeutic separation, have a plan about what you expect to see, in a certain time frame, and that he has those benchmarks, and I concur, consult a divorce attorney, know what your rights are. You guys have been married 18 years. It's good information to have, regardless of whether you ever use it or not, just so you have peace of mind about this is what it would look like. So, okay. Next question.
And there's other warning signs in there, like second D-Day, like you've already had disclosure and now you're getting another disclosure. He's not in recovery yet. He's probably not going to support groups, 12-step and all of that. I wonder, and for you, I have to say, as a spouse who has been violated, the thought that my partner's going to be out there living alone, no idea what they're doing on their own, is going to leave me worried all the time. If you're invested in this relationship, if he's invested in making the relationship better, why would he leave and make you more anxious, more fearful, and asking questions like this? How about saying to you, what do you think would be best for us? And asking you rather than throwing this at you and you're having to figure out in between the lines what's being said. So this really would be a good thing for the two of you to go to therapists about, even that CSAT, and say, can I come to one of your sessions? Because I don't know how to handle this, and I think we need support in figuring it out together. I don't think I take this one on alone. So that's my feedback.
Okay, can you explain what it is the sex addict is seeking? Validation, boost, and self-esteem. I'm so confused. My husband has everything he could need. Good job, wife that's trying to be patient and supportive. 2 loving, healthy kids. He continues to get in situations that lead to severe negative consequences. When accused of doing stuff, denies it completely, even if his story or rationale makes 0 sense. Tries to quick fix his life by trying to win the lottery, gamble, thinking that it will make things all better. Looks up stuff like how to change my life quick. He finds this change your life in 30 days crap. I'm just like, how dumb can you be? Where is the logic? He seems so sad, unhappy, insecure, and even at times seems to be truly remorseful and guilt for his actions. But I can't seem to know where to start or how to change. I'm starting to work on me, but having a hard time thinking it'll work.
Well, there are a lot of questions in there, Tammy. I would say at least 9 or 10. But I wanted to start by answering the first one. As a sex addict, I don't think that what I was seeking was, I do think I was seeking validation, but not in a sense that anyone in my adult family life or work could have given me. What I was looking for is the kind of validation that a 4-year-old or 7-year-old looks for, or someone who is so frightened of connection that I wanted control over how I made connection. You see, a sex worker and affair partner is never going to disappoint me, let me down, make me have negative feelings, because I could just pick another one. But If I turn to you, especially if your patient is supportive, that's scary. I could really get hurt in relationship to you. So, um, I do think that the current circumstances, I have a healthy life, a healthy job, I have a reason, is not necessarily going to keep, I don't think, and let me try it this way. I don't think a nice home, loving kids, and a good income ever kept an alcoholic from drinking. I don't think it ever helped a gambler not gamble. These are internal problems. In other words, you're asking intellectual questions, but the person's got an emotional problem. And so they can say from here, this, and this, but what's really going on, they're acting out. It isn't coming from here, essentially. It's coming from a very broken inner. And as far as like doing things that make no sense, well, that's something we do all the time. But it looks like, it doesn't this doesn't look like someone who's really in recovery. Because I don't, by the way, see anything about therapy, anything about 12-step programs, anything about support, and
It's the
looks
quick
up
fix.
stuff like,
Yeah.
yeah, this might be someone who is doing all this to shut you up. In other words, what can I do? And by the way, we have people who sign up for our courses, not because they should be there, but because it's a way of saying to their spouses, well, I did something, I did this. And it's not just that. It's, as Tammy said, it's the intellectual and the psychological and the emotional. We are broken, us addicts, on every level. And so, for example, in treatment, see, Tammy's taught me how to do this. At our treatment center, we're not just dealing with intellect, we're not just dealing with emotions, we're not just dealing with trauma, we're not just dealing with addiction, we're dealing with how it all fits together. And so that is a part thinking process, but a lot an emotional process. And honestly, when I challenge some of the men in treatment, a lot of them say they love their spouses, but they don't have any idea what it really means to love somebody. They're so filled with guilt and shame and secrecy that they can look like they're loving, but they're really not. So, yeah, this sounds like someone is looking for a quick fix, and I have to say in a little way, probably to keep you quiet. But that's just my guess.
Well, and
Tammy,
I
what do
was
you see?
thinking, I don't see it. I see looking for a quick fix, but also holding up this facade. Like, I have a good job, I have a loving wife, I have loving kids, and so the facade looks great into all those people on the outside. But he knows his brokenness and the shame and discomfort around all of that. And so, looking for the quick fix is, I get this all the time. With people looking for, well, if I just do this, and really, there's a saying around the 12 step, my best thinking got me here. And so he's not going to be able to think his way out of this, even if he's highly successful in his job. This is why we need help. You love a broken person. You will never understand his brain. I go on the betray partner groups sometimes, and I was like, you guys are looking from a normal brain that would never do this stuff, would never, do things that are so hurtful and have such negative consequences. And we are thinking with the back part of our brain that is just like breathing. I'm just going to go do this because that's what I need to do. And, the gambling, high intensity, but very compartmentalized. So he's one of those guys that, like, hang on, I would love to have him, consider seeking integrity. We do 4 to 5 hours of assessment. We were looking at all the underlying stuff before they even come in. We want to understand all those pieces that are put together, and how someone can. They have an aftercare plan for them. He's a married guy with 2 kids, so his aftercare plan is going to be different than someone who's single or someone who's retired or whatever. All of those nuances are what we need in order for us to be successful in living life on life's terms, not making up the wacky plan that he's trying to live by. So I would encourage you, join the Betray Partner groups on.
They're
I've
free.
got yeah, and it's on that one, I think, on sexandrelationshiphealing.com, and find out what healthy boundaries you need to keep you and your kiddos safe. That's, what do you need to do, for you and the kids, and set those boundaries to help you. It's not punitive. It's so that, there's a safe space for you.
I wanted to add one more thing, Tammy, because I see which I think is interesting. and even at times seems to have true remorse and guilt for his actions. So let me tell you what true remorse and guilt looks like. It looks nothing, it doesn't anything about words. Oh, I feel so terrible and you have no idea. I think I'm starting to really get what I did to you. No, 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 no. Remorse looks like I'm going to go to 3 meetings this week and I'm going to call my sponsor and we're going to go out for a cup of coffee and I'm going to start that therapy group. Remorse looks like action. If I really feel bad, we are full of words, us addicts. We have so many words that we can use and have used, but really it's all about action. And when I see, I don't necessarily mean your particular story, but already we've seen some stories. Didn't hear anything about a 12-step program. Didn't hear anything about therapy. Didn't hear anything about, this is all about action. Like Tammy said, if I could think my way into healing, I would. This requires, or if I could remorse and shame myself into doing. And actually, that leads to something I wrote down when you were talking, Tammy, which is something I hear from spouses all the time because I read your letters to the clients. You have impact letters that you send talking to us about what you've been through and what your experiences of the addict, and we read them to them so that they can see it from your perspective. And by the way, I've had many, many men say, my spouse has said that to me a million times, but when I hear it here, now I really hear it, because they're not just saying it, they're not just listening like, let me shut her up. They're looking at it like, oh, I'm hearing this in a way that I've never heard it before. But I hear this from spouses all the time, and I just want to comment on it. How could he love me and do this at the same time? And that's what Tammy's talking about, is our brokenness. You can't imagine, not even in the wildest fantasy, loving us and doing something so hurtful and destructive. But we do it without thought because we are able to compartmentalize, and we can put our sex life over here and our relationship and family life over there, and we can keep them completely separate in our minds so that we can love you, and we do. And we're doing all this crazy stuff because we're broken. And really, I can't say that strongly enough. We are really screwed up people. If we can do the things that we do to you and ourselves, we are broken. And I think actually that is a better way of thinking about it than we're bad. Because if you see us as bad people, nobody can help us if we're bad people. But if we're broken people, then we and others can help addicts grow and become better people. So it's a process that I don't see a lot of these folks fully in, Tammy, unfortunately.
I don't either.
Let's keep
Yeah.
moving.
Okay, last summer we had some kids over to swim ages 5 to 11, and my recovering SA husband had a sexual arousal when seeing one of the young girls in her bikini. He was alarmed because he has never viewed child porn and has not been attracted to kids, only adults. Could this be pedophile OCD? Will a CSAT be able to determine this through therapy, or is he lying to himself and me about a much deeper issue?
Well, I have to say what I like is that he told you. And my husband said that he got aroused. That is that's a really hard thing to say about this population, that you had an arousal interest at all. So that I do want to validate his going to you and saying this. This is what we want, is for him to say, hey, I had this thing and I don't know what to do with it, but I want to tell you and not keep it a secret. What it means, I don't know. I mean, I haven't interviewed him. I don't know him. I don't know what that 11-year-old looked like. And I'm not in any way saying you should be interested in 11-year-old, but there are 12-year-olds who are, they're busty. And, I had hair on my chest at 12. So excuse the personal statement. So, but I don't want to blame the victim. It's obviously inappropriate. It obviously doesn't make sense. I don't know whether he's done this one time or 100, and neither do you. So the answer to this, you can make up any kind of answer you want, but I would want to, yes, a CSAT will help determine what this is all about if he's willing to be honest. If he's not willing to be honest with a therapist, then, all bets are off. So is he lying to yourself and you about a much deeper issue? I have no idea at all. Tammy, I guess, do you have more thoughts?
No, I mean, yeah, and just so you know, I mean, not most CSATs are, I mean, they might be able to have an inkling about what's going on and they can do some basic assessment. But at the end of the day, there are sex offender assessments that are very different. So, I don't know that one, but not do, and it says, this is last summer. So here we are tomorrow is February, and it's deeply concerning to me that this much time has passed and there hasn't been a full-on assessment. So sooner rather than later would be my encouragement. So, okay, next question. I am a male addict in recovery for just under a year. I'm finally fully opening up to being completely vulnerable with and fully sharing whatever I think of and possibly can with my partner. Oh my. Like that's my personal reaction. That wasn't in there. In the past 2 days or so, I've been having mental blocks on things to share. Any advice on how to get over or through these blocks? Are there any specific sharing exercises that I can do to stimulate the process further?
Well, Tammy, you said, "Oh my," and so you're gonna have to explain that to
I
us.
love my husband. I don't want to know and he doesn't want to know mine. Like, I don't want to know every single one of his thoughts, like, oh, and he would probably like me to talk a little less. So that's a whole different thing. That's what I was like, being completely vulnerable and fully sharing. I'm like, that's a lot. That's a lot of that to me. It's just like, and with your partner. So to me, I have a recovering community that I go share a lot of stuff with, and so like I don't know. Like I guess I'm having I think having some things, go share with your sponsor, not with your partner. But that's me.
Well, I see this person looking for advice, and
Yeah.
I don't know you guys, and I wouldn't know how to advise you, but I really think this is a therapy thing. Like when you say you're looking for exercises, to me, that means you're looking for a professional to guide you because book exercises are great, but these issues are way too traumatic to read a little questionnaire and say, oh, okay, I'll just go through this. So, I do think that you're someone who should be in a betrayed partners group to begin to hear how other people are handling this. I don't see anything about disclosure,
This
which is
person is the male addict.
oh, and fully
Yes.
sharing with
And
my
that's why,
partner. Oh,
yes,
I see.
that was my, like, I don't think partners need to hear every detail. And on some level, I'm also going, just have some fun. Like do something that's like not about sharing deeply on every single level. Like, oh my gosh, it just feels like that feels heavy to me. But maybe it's just me. Maybe I don't have the emotional tolerance. I don't know.
Well, I also think, again, I'm going to go back to therapy because if you don't know what to say or how to say it, you should be guided. And if your partner doesn't have the emotional support to hear those things, you can completely overwhelm him or her with your answers. It's great that you feel you're ready to be vulnerable. Does that mean your spouse has the support to hear it and get supported, or are they going to want to kill themselves after they hear all this? Do you understand how to do this? Meaning that we strongly discourage graphic details. We don't want you to say, this person had big V's, or, I was fantasizing about that when I was with them, or, specific details about your sexual acting out will leave your spouse never able to be sexual with you again without thinking about all this, no less walk down the street. So I do think what Tammy said is accurate. You don't want to share every single thought, no matter how vulnerable you're feeling. You need to take direction from people who can advise you. And I appreciate you're asking it here, but this is, come sit with us for a couple of hours and work on it or find the right therapist. By the way, if you are looking for someone to work with, Tammy often makes referrals around the country. She and I know people, all kinds of really good
Around the
therapists, and
world.
we know the ones who aren't so good. So it's TAMI, it's 4-letter word, TAMI at Seeking Integrity. We don't get kickbacks, but we do make really good referrals because we know those folks. And a lot of them sit with me in consultation every week. So I get to know them by their questions, as I've trained most of them, to be honest, at this point. You ready, Tammy, for another
Yes.
question?
I am the partner married to an SAPA for 16 years, D-Day 21 months ago. Both have been seeing a CSAT for 16 months. He does 2 12-step meetings a week, been sober 9 months. The problem is I feel like he does not make amends or show any remorse, although he denies this. He has said he is sorry 3 to 4 times as he is trying to push me on the bed and have sex. To me, this is not sorry. This is still occasional issues with dishonesty and blame shifting, etc. What are your thoughts? I feel like this is sobriety, not recovery. I had a physical reaction when he pushes me on the bed and says, sorry. I'm like, I'm sorry. That would feel like rape to me. I'm sorry. That's I would feel violated. That's me. I'm not saying that's you.
Well, I want to affirm that, Tammy, because when I said I read spouses impact letters, I have at least seen maybe 20% or so that where a spouse said, you demanded sex of me, you pushed me into being sexual, I went along with it just to, keep you from being with other people or shut you up, or, I think this is a really important thing. You have no amends. He has no remorse. He said sorry and then wants to have sex with you. Boy, talk about somebody who needs to be in treatment. This is someone who looks and sounds quite troubled. And I said 20% because not everybody comes in and says they pressured their spouse for sex and they pushed them when they didn't want it. But there are some that do, and I worry about their relationships because you're going along with it is not going to help the situation at all. It's just going to make you feel bad about yourself. And by the way, who says he's sober? Who says that he's really doing the work? Have you had a STD test yourself to make sure that you haven't been given something? And again, sorry is not about words, it's about behavior. And it certainly isn't the behavior trying to push you into sex. And again, I don't see, yes, first of all, I have one more thought, which is where it says both have been seeing a CSAT for 16 months. I wonder if that's two different people, because I would feel uncomfortable if you were both going to the same person, especially at the same time. Because one of our more difficult things as therapists is if we're doing couples work and one partner says, well, I did this, but don't tell my spouse. And then I don't tell their spouse, well, then I'm lying to them by omission. And would you ever want to come to see me again if I kept a secret with your addict husband and didn't tell you? So I always feel that it's better for each of us to have someone to see. And even if you do disclosure or something, maybe both of them could sit on a screen and work with you, because the better the person knows each of you and your challenges, the more likely it is that you're going to work this out. And this is really disturbing. And I agree with you. It doesn't sound like recovery, but I'm not sure it even sounds like sobriety, because do you realize that you can be the object of his addiction and he can be objectifying and using you in addictive patterns? So even though he may not be going out there, he's still acting in the same way, pushing, demanding, getting at whatever he wants to with you. And that is just as disturbing to me. So a lot of work here, I think, for sure. And trust your feelings because they're right.
Yes, and I was thinking the same thing. I would have both CSATs and both of you, like I would look to schedule a conjoint session so that you guys can talk about this. But it does not feel like there's accountability for him. But the words are irrelevant. It really is actions, and the pushing you on the bed to have sex, that is not okay. I'm sorry. Okay. Next question. Hi, Dr. Rob and Tammy. Firstly, thank you so much for your free groups and YouTubes. I found CSATs for my husband and me through Seeking Integrity, and it saved my life. So thank you. I'm a betrayed female partner married to a sex addict for 12 years. Found out my husband was acting out 11 years ago. Trickled disclosure over the years, and I'm not ready to put up boundaries till a year ago. Oh, and I was not willing to put up boundaries until a year ago. Since then, things have gotten worse. He broke my boundaries, got defensive, depressed, and threatened suicide. My question is, go ahead. You want to interrupt?
No,
right
I just said,
yeah. My question is, he is now sober for nearly 4 months. He sees his CSAT once a week or once every 2 weeks, depending on his CSAT has time, and he goes to one 12-step group a week. He has just put a new boundary to say that I don't feel safe to have sex. No, I've just put on a new boundary to say that I don't feel safe to have sex until I feel he is in recovery and not just sober. So I want him to go to more groups. I agree. Read books, do 12-step work on facing the shadows that a CSAT recommended. And I got him out of the doghouse a year ago, and he has not opened the book yet. Oh, fudge. There's probably more. I got to tell you guys, if they don't, oh, here it is. Sorry, it cut out. Okay, so I'm going to, here it comes. You can see the next part. listen to podcasts and watch YouTube without addiction, having a sponsor, but he is not willing to do any of it yet. He says he is not going to be beneficial to his recovery because he's so smart in recovery. We talked about this earlier, like
Tammy,
our
you're
best
being
thinking got us
sarcastic.
here.
I can just tell.
I'm sorry. I'm sorry.
Okay.
Okay, but he is not willing to do any of this stuff because he says it's not going to be beneficial for his recovery. That for him, he just needs to believe in God and have a CSAT and 1 12-step a week, and he's all right. Is there hope for him to be in full recovery that way? When I give him this boundary, he decided to sleep in a different room and avoid me. I feel so helpless and defeated. Sorry for the ramble. Thank you.
Well, you want to start, Tammy? Or, I mean, there's a lot there. Would you like me to?
There is a lot there. So, I mean, really interesting that he took himself to another room, like, but I go back to, I mean, like at the end of the day, you guys get to decide, what do you want? And if you want a relationship together, the Out of the Doghouse book, I mean, I don't even know, it's thin. It's not like, this is not, War and Peace. This is a thin book, but it's got practical tools to how to rebuild a relationship. It's not that hard, but he can't do it alone. And if he's going to consistently do this, I think he's telling you really clearly, nope, I'm going to do my own thing. But that would make me have stronger boundaries. I would reinforce my boundaries. That's me.
Well, there's so much there. Thank you, Tammy.
I know. I'm annoyed with that one.
I think Just You is perfectly fine. What are you doing? Polishing up the logo back there?
No, I'm looking for Out of the Doghouse.
Oh, okay. Well, let me say a few things. What I really don't like, just to say it, is I don't know what the word is, the casual use of the word God. I don't know what your beliefs are, but do you really, does he all of a sudden believe in God because now he's in trouble, or did he believe in God before? Because if he had any spiritual beliefs before, that didn't stop him from acting out then. So why would it stop him from acting out now? And belief in God is not an action. What did you say, Tammy, about potatoes? Can you say that again?
If you pray for potatoes, you better pick up the spade. You got to do the work. So
right, exactly. And this is not this just disturbs me in all kinds of ways. And you are really someone, plus the suicide thing. I've had a bunch of guys come in and it was so manipulative that they wanted their spouse to calm down. They wanted their attention. They didn't want them to leave, whatever the reason was. And they ended up in a hospital for a night because they threatened suicide, even though many of them have told me I would never have done that. What I was trying to do was manipulate. At least they tell me that in treatment. By the way, this is somebody who needs to go to treatment. I can't see enough reasons why he should stay home with you. Trickling disclosure, 12 years. What I appreciate is you're starting to put up boundaries and they're being broken. So that tells me that that you need to find a space that's safe for you. And I honestly, and I mean this most sincerely, I would put him out. I would say you need to stay with your family or your sister or your friend from college or whatever it is, because I don't want you in this house. I asked you to leave my bed and you're punishing me by going in another room just because I won't have sex with you. And you're not looking at the materials that, I mean, part of what I see, Tammy, and I wanted to say to you is, it's really not, if I am in a relationship with you and I have hurt you, it's my job to discuss with you what would make us both feel comfortable about my recovery. So if you said, I really want you to go to 3 meetings a week, maybe I can negotiate to 2, but it doesn't mean that because I don't want to do it, that I don't want to take your suggestion. You're not my teacher or spouse, or you're not my teacher or parent. You're not making suggestions. You're telling me what would make you feel comfortable. And for him to ignore that or say he's going to do his own thing or walk out into the other room, I just think there are all kinds of, not just red flags. I don't like him. I do not like this man because he isn't treating you well and he's not respecting his family. So I have to say, let me get my hands on him and I will turn him into someone else. Seriously, I do get involved in treatment. So I sometimes get a little challenging, but this is somebody who's so caught up in their own bullshit and trying to pull you in over and over again that I don't have a lot of faith in this person's recovery. not from what I'm reading from you.
Oh,
Yeah,
I
a sad
think
story.
zero recovery. He may not be acting out. I don't know. I might be willing to give him that, but everything else, and like, I'm sorry, but Dr. Rob, if I said 3 meetings a week that I really needed you to do that, you know what? Do 5. Do 5. Be an overachiever on that stuff. And going back to the person that was like, the husband was like, I'm looking for a 30-day quick fix. You know what the fastest way to do things differently is? Lean into your recovery with the same intensity that you leaned into your addiction. You're going to do great. For porn users, did you look at porn 50 minutes a week, once a week, like you go to your therapist? No. Well, did you think about it any other time? I mean, it is intrusive. It is invasive. It's one of those things where you can get help. And the quicker you do the things that are suggested, it makes a difference. We had that Sex Addiction 101 group start on Saturday. There's still room, and there's another one starting on 2/18. But those are some basic things, and I'm glad you're starting to put down some boundaries. Like I said, shore them up. Bigger boundaries. So, for your safety, I mean, this honestly, you know what it is? I feel like this guy is completely immature, like so immature. I want this. I'm doing this. Me, and nothing about, what you need for safety. So,
and you're getting threatened. Well, if you don't have sex with me, then forget it. I'm going to go in the other bedroom because you're punishing me. That's someone who's still trying to hold on to control or thinks they have it. I would say, you know what? I don't want you in the other bedroom. I'm changing the locks, because I think when addicts are running the show, and running you around by the nose by saying, well, I'm going to do this and I'm not going to do that. Maybe I'll get to this. Something's not right at that party. Because in fact, I just share a lot of concern with Tammy about this particular situation and the one before it, because it doesn't sound like people who are taking this or you seriously, and everything's on the line. They just don't get it. Yeah, good to put up the boundaries. I agree with Tammy.
So I checked, and Out of the Doghouse is less than 200 pages. So and there's lots of fill in the blanks. It's not, it's not rocket science. So, okay, next question.
And I want to say one more thing to the person who has spiritual beliefs. If you happen to be a Christian, I wrote with a pastor friend, Out of the Doghouse for Christian Men. So we can't.
Yes.
Oh, thanks,
and
Tammy.
both of the, I don't know if you can see them, but they're on our website, on the sexandrelationshiphealing.com site. We have resources, and it includes books, and there's bunches of books, that support both partners and, people struggling. So, and like all kinds of good stuff. So, okay. Next question. How long does it usually take for an SA to remember things they've done in the past? Do they really not remember, or while in active addiction, do they not even realize the actions are unacceptable, or the addiction?
Okay, so let me take on the first question. Do they really not remember? I don't think that addicts remember the frequency or a particular person or what they did on a particular vacation or whatever. I mean, that's why we work with them on disclosure, to help. I don't believe that someone coming into treatment is ready to disclose stuff to you, because they just don't remember all of it, and that doesn't mean that they don't care about you or you're finding out. It really means that there are pieces we don't remember. So, however, the majority of what we've done, we remember. And in terms of saying, I don't know how many people, how many sex workers I've been with, but I've been with probably 3 a week for the past 5 years. We can tell you that. We can give you general insight into what has happened without going through each detail. Going through details, I still think, is a therapeutic process, one that should be done with a professional, and preferably a CSAT or someone who knows this work or knows what they're doing. But I don't think, again, that he doesn't really remember. He doesn't remember little details, but we remember the majority of it, unless he was doing drugs or drinking heavily at the same time. Do they realize, here, this one's for you, Tammy. Do they not even realize that their actions are unacceptable, and or the addiction? I think, or the fact that they have an addiction.
Yeah. And I would say, yes, I think that's very compartmentalized, and it is. So Kim Buck in one of the webinars shared that the addiction's in the same part of the brain as breathing. And I was like, oh my gosh, that makes so much sense, because we're going to breathe, we're going to make sure that we're able to breathe. And that's where addiction is way back here, nowhere near the front part of our brain where we actually think about it and go, would this be a good choice for our relationship? Is this going to be something that my partner is going to be happy about? Zero thinking about that. And that's when we're talking earlier about partners, you'll never understand our crazy brain. And I'm not saying crazy, and it just thinks differently. I still think differently. My daughter and husband, like my daughter has never known me in active addiction. And like, we had a conversation a few months ago, and I was like, yeah, I struggle. Like, this is my brain thinking, and I have to think, like, is that really true? And it's one of those things where it's different. We addicts get it. We go to meetings and we laugh about stupid stuff that we did, and like anybody else is going to go, what were you thinking? We weren't, but it made perfect sense in addiction, I mean,
Right. At the moment.
yeah. So completely compartmentalized. And I see it as very siloed. So this compartment where I'm acting out and doing things that would be hurtful to you, oh, that's completely different. When I walk in the door and say hi, completely, that those don't touch. And I really am glad to see you, and I'm glad I'm home, and I love you. But that still happened. And it does take, it's why, working with a qualified professional, where they start working on the timeline, not that they share the timeline with you verbatim, but it pulls that data together so that they get that. But, I've listened to the clinical team, and people will say something in a group and it's not on their timeline. There is a disconnect. And so working with the right professionals to help pull that information together, that makes a big difference. So
I want to answer to the last part of the question. Do they not even realize the actions are unacceptable, which is what you were talking about, Tammy? This is what denial is. Don't even know. Okay, denial. You want to write down what this acronym means? Don't even know I am lying. That's how we call it a lie. Don't even know that I'm lying. So, I can think to myself, oh, we're not having a lot of sex, so it's okay for me to go do this. Or it's not really an addiction. I just have a high sex drive. There are so many ways that we find to tell ourselves that what we're doing is okay. I mean, we honestly, if we saw it as not being okay and really saw the ramifications, we wouldn't be able to do it. But we deliberately avoid seeing. In fact, one of the first things that we do in Seeking Integrity, and you'll see me write this when I write about addiction, is the first thing we have to do is break apart those distortions. Here's a good one. What he or she doesn't know won't hurt them. But it does hurt everybody. It hurts you. It hurts the family. It hurts, if nothing else, the person's emotionally unavailable, non-intimate, lying. So yeah, I don't think that we understand the depth of the problem, the degree of the problem, and sometimes we don't even know we have a problem because it's your fault. I mean, you gained weight and don't have enough sex with me, so of course it's your fault. So really, I absolutely think that we don't get it. That's why we go to so many meetings. That's why we go to therapy. For us, not just to learn how to not do it, but to recognize when I'm thinking the wrong way. I mean, we don't even see it coming. So absolutely, I do. I think it's true. In fact, the longer we're doing this work, whether it's 12-step meetings or therapy or groups, the easier it is for us to recognize when we're in trouble. And that's one of the things we do in treatment, absolutely, is say, what are your warning signs? Not just what is your behavior, but what are the things that tell you you're going to get in trouble. So this is a great question, because no, we do not realize for the most part that certainly that it's an addiction. We may know it's unacceptable because we'll hide it, but we certainly don't see it as addiction for the most part.
Yeah, and the lies of omission, and we hear this on disclosures all the time. Things were omitted, and you go, you know what? You leave those important things off because you're afraid of the reaction. You know what's going to happen when they do find out, and they will. The reaction's worse. It's way worse. So. Okay, next question. I am a sex and love addict and constantly feel like my partner is going to leave me. I have been doing inner child work, so I maintain boundaries when I am with my partner, but I always feel so worried they are going to leave me. How do I work on my abandonment issues?
It's a great question.
So
Go ahead,
Troy
Tammy.
Love has a work group starting February 7th that's on those exact things.
It is.
It's the attachment wound stuff. So, you know, and I get the fear. I really do. I get the fear, but we also learn that fear is not reality. And like Dr. Rob was just, saying too, we have to confront those misbeliefs. So I hear what you're saying, that I'm doing the inner child work and I maintain boundaries when I'm with my partner. That's great. So you're learning pieces of that. And I'm not talking about this, but for I used to have to go because I had this fear, and I was like, what's the worst that can happen? And like I'd have to play through, like, what's the absolute worst that can happen? So my partner leaves me. That would suck, but I will survive it. I will learn to do life better. I mean, I did all those. And once I accepted that I would survive the absolute worst, then I was more able to see what reality really was. So that was helpful for me. Okay. Any thoughts that you'd like? Yes, please.
Well, I'm running around. I'm answering questions in the chat, which I'm not supposed to do, but I want to anyway.
Right.
Okay. So, hold on one second. I want to get to the right question. Here we go.
It's the 602 on the Sex and Love Addict. Okay.
It says 502 on mine.
Oh, time difference. Yeah.
I
Arizona.
understand this, and I am so glad that you have an understanding that this is more of a thought than a reality, because I don't hear you saying my partner's talking about leaving me, they don't want to be with me. I will say that if you get sober and you stop acting out, these are the kinds of things that come up. When I'm constantly running to a stranger for sex, I'm not worried about abandonment. But once I am solely with one person and focused on the intimacy between us, it's like I said before, if I have sex with a sex worker or an affair partner, or, I don't have any fear. I have control there. No sex worker is going to abandon me. I could just find another one. But in this situation, this is when it really starts to get scary. This is when the rubber hits the road, because I don't have any other way of escaping these fears. And so I think you've already taken a big step, which is recognizing that this is an issue. The other thing is, I would really tell your partner, not ask them how they can prove to you that they're not going to abandon you, and not that you're telling them to manipulate them, but you can say, I live in a lot of fear that that we're not going to be together. And with all the stuff I've done, I actually think that would make sense. And so I really respect wherever you're at, but I do live in this fear, and it's something I'm learning to get over and be at peace with. But I absolutely think these are things from the past that are showing up now because you're really working on it. And I also say to all addicts that, our behavior is well, Tammy said this, the tip of the iceberg. It's the part that you can see. It's the symptom. Although most partners wouldn't call it a symptom, trust me, the acting out is a symptom of other things that are underneath. And your abandonment is what lies underneath the acting out. So just think about this. If you're able to tolerate these feelings and not act out over them, you're going to grow. So, and if you race to fix them, you're not going to grow. So, what do we got left, Tammy? Another question?
Oh yeah, we've got hi, hey Dr. Robin, Tammy. I was diagnosed with OCD many years ago and had this issue before porn issues. I'm wondering, what is the general approach for someone struggling with OCD and porn? I'm not sure what is driving what, and I need to find healing ASAP before this gets worse.
Okay, well, to me, this is a fairly simple answer, which is go see a really good psychiatrist, because I work with lots of people who have OCD, but when they are on the right medication, like we work with people who are bipolar, and when they're manic, they're having sex everywhere. And OCD, people are having sex compulsively. We actually work with people who have ADD, attention deficit, and they have sex impulsively. So, it's not unusual for these things to go together, but if you don't get your it's sort of like, it's like if people are still drinking and using, they're not going to be able to deal with this stuff, because you actually have to have a clear mind to deal with this stuff. So unless you really have your mental health in place, it's much harder to even answer questions like this. You don't need to be a professional in my field. You just need to go see one. And any amount of money that it costs you is going to come back in endless payoff, because you're going to be much clearer on what's going on and what isn't. If you have OCD and you're properly medicated, you're probably going to know if you have an obsessive relationship with sex, or if your obsession about everything is running into the sex. But go see a good doctor. That's what I would do.
So tagging onto that one, I'm going to ask you this one too. So how about dual diagnosis? If a sex addict also has mental challenges, do they need to be addressed separately? So, and you kind of talked about with OCD, but there's lots more. So can you just elaborate a little bit?
Well, I think there's a difference between a psychiatrist and seeing a therapist. Psychiatrists have a particular purpose in our lives, which is they're doctors, they're MDs, and their goal is to diagnose any medical or psychological issues that may be alleviated with medication. So does my psychiatrist need to know that I'm obsessive and that I use porn compulsively? Absolutely, they need to know that. Do I expect that being on medication or seeing the psychiatrist is going to help me with my emotional and mental challenges? No, that's what therapy is for. But yeah, you have to get those mental health issues stabilized. You know, when I was dealing with a lot of depression, which I've had on and off my whole life, you know, how successful I was going to be wasn't really clear to me because I couldn't get out of bed. So how successful you're going to be or your recovery and how it's going to make you feel, and whether you're going to want to act out or not, is really not going to be served and understood until you see someone who can look at you and say, I think these meds would help. So, and meds help, by the way. I have no problem. And I'll just say for me personally, if something will help me, I'm all over it. Whether it's going to a meeting or seeing a therapist or getting a sponsor, whatever, I am not hesitant about bringing things on board that will help me in my relationships in my life. Some of you are like, oh, and no judgment. I just don't think this is a helpful way of thinking. Some of you are saying, well, I wish I could do it without medication. I'm just going to barrel my way through and I can figure it. And I just think, why bother? It's like, you know, unless you are a drug addict and you're trying to medicate, you know, your feelings. And by the way, the drugs we take for OCD and depression don't feel particularly good. So they're not like taking fun drugs. But if you don't get this piece handled, it's really hard to understand your relationship with the sex and the addiction. You want to do one more just for the heck, or do you have to go,
Sure.
Tammy?
No, I'm good. So
Okay.
I'm going to work on your slides next. So, okay. There is, let me see, I've been typing. So, how do I forgive myself for having betrayed my partner? My partner does not know. I never physically cheated, but I started reaching out to old qualifiers and fantasizing about cheating. After a few days and the realization that I was doing the wrong thing, I reblocked them and recommitted to my partner. I feel guilty, but I do not feel I need to disclose. I feel I have, I just need to make a living amends and not do that again. How do I get rid of the guilt I feel?
Well, I heard I do. First of all, I don't know what you're doing. So, you know, if you say you never physically cheated, masturbation to porn is physically cheating. It may not be with another person, but you're engaged in sexual activity that's going to affect your relationship. So I don't know what you mean by physically cheated. It sounds like a nice way of saying what I did wasn't as bad as what other people did. And, you know, I can't compare my pain to someone else's. I can't compare to my acting out to someone else's. I can just say for me, this is what the problem is and how it's causing problems in my life. So, and look, Tammy, I think when they say I was doing the wrong thing and reblocked them, I think it has something to do with romantic behavior or sexting or something like that online with another person.
Fantasizing, yes, yeah, and
And
reaching out to old qualifiers. So yeah, problem.
and let me tell you why you need to disclose with the support of a therapist is that she's going to find it. He's going to find it. They're going to look on your computer and they were going to do their detective work. And I trust me, they will hire someone to go through that hard drive. And when it is found out that you've been chatting with this person, even though you block them now, and when your spouse sees what that conversation has been, it's not going to go well for you. So I would rather be ahead of it and say, under the right circumstances, when you're getting support, and I think you need to know. In fact, I'll just say to all of you, I don't have to tell my spouse if I look at someone on the street or if I drive through the wrong neighborhood but I do need to tell my spouse if I have a slip. If I go into a behavior, actively sexual or not, where I am doing something that I know would hurt them and I have agreed to them I'm not going to do, I have to tell them because as angry and hurt as a spouse is when they hear what I've been doing, it's more angering and more hurtful when they realize that I haven't been honest with them. You know, if I tell you I was looking at porn last night and it's not on my plan and I lost my sobriety, you're not going to be happy with me. We're not going to have a good evening. But there's something I think in most spouses that will go off that says, huh, I don't like what's happened, but I actually know what's happening. This person actually told me, and I'm used to guessing and having it be a secret. So I do think you need to disclose, but under the problem. And guess what? You might feel less guilty, but it has to be in the right circumstances. Tammy, it's a pleasure working with you.
Yeah. Well, but I want to tag on. I was like,
go for it.
Your partner will find out, and then it's going to be an atom bomb. You know, so I agree with Dr. Rob that, you know, you're working a program of honesty. You hiding behaviors because you don't really want them to find out, and I didn't really physically cheat. That's justification and denial. Goes right back to what Dr. Rob was saying about denial. So this is cheating. If your partner was sitting there watching what you were doing on your phone, would your partner have been okay with it? No, you know. So it's, yeah, you had a slip, and I would go so far as it's a relapse because you haven't come clean in 24 hours. So like, yeah, I think it's a problem. And until and unless you disclose that with I would get the qualified professionals involved as well. But your partner will find out. They do. And they are devastated. They're more devastated when they find out because they discovered it, and they will.
Well, and because they thought like this was the bottom, and that this was as bad it was going to get, and they could deal with that and start moving. But then they find out there's more. It's like it's a never-ending roll into darkness, you know. I do want to say something more about living amends. So a living amends is something that I do when I'm unable to make an apology or clear the issue up. So, for example, someone may have died that I really hurt in the past, and I cannot do anything to heal the issue with them, but I can live in a way that living amends, that where I'm giving of myself in order to sort of make up for the harm that I caused. I can't make it up with them, but I can feel good about myself by giving to others, which is a living amends to me. But if my partner's right there and I'm just choosing to not tell them, we don't call, I don't care how many things you do for them, you're not making a living amends because you're lying to them. And lying by omission, as Tammy said, is lying. Well, I just didn't tell them. You lied to them. And by the way, they hate that. They really hate that. Do we need to stop, Tammy?
We should, yeah.
Okay,
well, we have two more
stop.
questions. It's up to you.
I know, but you know, better leave folks wanting more than to completely meet all of their needs. So we love you, folks. Thanks for being here. I want you to remind you that this thing that Tammy and I do is a podcast, which is called
Overcoming Addiction and Betrayal is ours.
Right.
But we also have the Sex, Love, and Addiction podcast has had nearly 900,000 downloads on it. So that they're super informative, but all of the stuff on sexandrelationshiphealing.com, great resources for like this for both addicts and partners. But there's drop-in groups specifically for each of you. Please lean into those resources. And I put the link for the work groups, psychoeducation, really good support that are in seekingintegrity.com. The Out of the Doghouse starts tomorrow night. Troy Love's Attachment Wound starts on the 7th of February. Great stuff, you know, so lean into it.
Let me ask you, Tammy, are attachment wounds, is that gender separate? Because we try to do everything.
This is just for male. Yeah, this is for male. And I think we'll have some other stuff later, but
yeah,
we're gonna have
I think we should have a women's
group.
Attachment issues for sure, because we rip the heart out of their attachments, you know. So anyway,
one thing at a time, Dr. Rob. We have like a zillion things. Balls we're juggling in the air. So stay tuned. We're going to keep adding it. So, okay. Thanks, everybody. Bye.
Thank you, Tammy. I'll see you tomorrow. Bye, guys.
Bye.